Hi, my name is Amy.
And I'm Dr. Alvin Freed.
Welcome to Diabetes Gateway, your guide to the world of diabetes. Over the coming weeks and months, we will be giving you a wealth of information about diabetes in an easy-to-understand form. Our resident expert, Dr. Alvin Freed, will be addressing questions sent in by people all over the world concerned about diabetes. In this week's episode, we will cover, what is diabetes? Why are we hearing so much about diabetes?
The CDC, the Center for Disease Control, has declared diabetes an epidemic. There are about 26 million known diabetics in this country, and that number is increasing at the rate of 2 million every year. It's gotten so bad that by the year 2050, about 1/3 of the country is predicted to be diabetic.
What causes diabetes?
The human body runs on sugar, much like a car runs on gasoline. Diabetes occurs when the body can't use sugar as a fuel. There are many reasons for this, but the main problem is that a tiny structure called an insulin receptor isn't working properly. This clip from the DVD Diabetes Sweet and Simple will illustrate this very nicely. The insulin receptor, enlarged here a few million times, is a minute structure on the surface of all the cells of the body. The insulin attaches to the receptor, which allows the sugar that your blood delivers to the cell to enter the cell and act as fuel for the cell's activities. Unless the insulin receptors are working properly, the sugar arrives at a locked door without a key. There's no way into the cell. The insulin itself usually provides that key. The insulin, or the key, is there, but the keyhole, the receptor, isn't working.
Who is most likely to get diabetes?
Anyone can, but there are certain characteristics that make one more likely to develop it. Being overweight, a sedentary lifestyle are two major reasons for developing diabetes. Heredity and genetics play a large part. If it's in your family, you're more likely to develop it. Lastly, there are certain ethnic groups that have a greater than normal chance. Especially vulnerable are Native Americans, Black and Hispanic Americans, Native Alaskan Americans, and Pacific Islanders.
Is diabetes permanent?
Type 1 and Type 2 are usually present for life. They can be controlled but not eliminated. There is another major type of diabetes. It's called gestational diabetes because it occurs in pregnant women. This form of diabetes occurs during pregnancy and usually disappears rapidly after the baby is born.
Join us next time for part 2 of What is Diabetes? Check us out on the web at diabetesempowerment.com or facebook.com/diabetesempowerment.